Okay guys, so here is the whole process of setting up the continuous nebulizer all together for the midterm. So you're gonna, knock knock. Hi, my name is Lauren. I'm from respiratory. Washing my hands, putting on my gloves. I'm going to I will have vitals up. So you guys are gonna look at the patient's vitals. So you're gonna check the heart rate, the SpO2, breath sounds, and respiratory rate. So pretend I have stethoscopes on. I'm gonna check all my vitals, listen to breath sounds, chart all my data. Then you're gonna actually put your device, you can put your device together beforehand, or you can do it after you do all your vitals. So to actually set up the continuous nebulizer, remember, so we have the actual neb itself. We have our blue corrugated tubing. So we add or plug this into your larger port on the side here. And then on the other end of that corrugated tubing, you're going to attach either an aerosol mask or a mouthpiece. It's up to your patient if they are able to hold a mouthpiece. They can do that. Just let them know that it's going to be a very long treatment, and their mouth, can get tired having to hold that, because you want them to have, a good seal around that mouthpiece. So I usually recommend that they wear a mask. Again, it's up to your patient. Then you're going to want to get your extra oxygen tubing and plug that into the top part of the neb. So all together, it looks like this. So I have my mask, enough corrugated tubing that my patient has slack if they need to move around or whatever a little bit in the bed, so that's not going to yank on their face. My neb is set up, and then my extra oxygen line that will actually plug into your flow meter. All right. So let me get this guy plugged in. Okay, so once you have all your equipment set up, you've done your vitals check and all that good stuff, you're going to actually add your solution into your neb. So we will have these little saline bullets to represent our albuterol or our DUNEB, whatever is ordered. So in this case, the doctor has ordered 10 milligrams of albuterol. That's to be ran per hour over 2 hours. So 10 milligrams of albuterol per hour over 2 hours. So altogether, we need 20 milligrams of albuterol, which is 4 mLs. So that is 8 vials of albuterol, or little ampule guys. Because remember, 1 ampule is 2.5 milligrams. So 4 times 2.5 is 10. So we need 20, so we need 8 total. But again, we're just using these guys. These are the little saline bullets, are 5 mLs. So you're just going to use a little bit less than this on the test. So you're going to get your nebulizer. You're going to add your 4 or whatever is ordered mLs of albuterol. And then, so this order was, or this treatment was ordered for 2 hours. So with the Misty Neb, this guy ran at 11 liters per minute, which is what the manufacturer recommends for this particular device. I need a total of 60 mLs in this bottle. So I already have 4 mLs of my medication. So I need 56 mLs of solution to get the rest of my liquid in there. Normally, you would use sterile water that comes in a bottle like this. You can also use sodium chloride, like if your patient has a ton of secretions, like really dry, thick secretions. This is basically, remember, just salt water. It can help loosen and mobilize those secretions. But typically it's just given with sterile water. So I have my 4 mLs of medication in here. I'm going to take my sterile water and fill the rest up until I get to that 60 mark. You'll see here, these go in increments of 30. So it's 30, 60 in the middle, then 90, so on and so forth. So I have a total of 60 mLs in here. That will run for 2 hours. Then I'm going to turn it back on, plug it back in. These guys are like any other nebulizer. They have to be, fairly upright to run properly. So I will oftentimes use Coban to secure it to like the patient's bed rail. So if this is up, I will take Coban and like secure it, like so that way it stays up. Again, this is also why you want a long, extension for your patients so it's not tugging on their face, so they can move around a little bit, things like that. I will not require you guys to do that on the test, but just for your own information. So once you've got that all plugged in, you think you're good to go, you're going to put your treatment on your patient. And then you're going to turn on your nebulizer at 11 liters per minute. And then kind of rotate this guy around a little bit. And then you're going to check to make sure that you have mist. When you do, you're going to call me over and I will check it. So that is station 1.